Hello everyone, my name is Prashraya Tuladhar.
And my name is Shrestha.
And welcome to Pop Talk, Nepal's #1 podcast.
We're trying to be, at least. We're trying to be, man.
So do you know any pops who are doing podcast?
Not as of now.
That's the main reason why we are the #1 podcast in Nepal.
So that proves we're #1 podcast that we're doing Pop Talk.
So Pop Talk ko concept चाहिँ नि कस्तो हो भन्दाखेरि we'll be bringing in a lot of influential people and we'll be learning a lot of things from them, from their experiences, from their knowledge. And you know, basically what we do in pop, like pop ma ke kura garcha we talk about life, we talk about motivation, we talk about business, we talk about anything and everything, from politics to everything, right?
And त्यही कुरा गरिराख्दाखेरि फेरि यो पप टकको मेन मोटिभ भनेको इट्स नट अल बोरिङ टक्स हैन, हामीले बिजनेसको कुरा पनि गरेर हुन्छ, बट देन अगेन अल अनवाइन्डिङ टक्सहरु पनि हुन्छ, सम फन टक्स पनि हुन्छ, र you know, it's just a fun talks, anything and everything.
Yeah,
basically.
With that being said, thank you so much to Irish Pub Company for letting us do it here.
Thank you.
Yellowworks TV for making this happen for us.
Of course.
Thank you to all our friends and family and supporters who always been supporting us.
Absolutely.
While we do the things we love doing, right? So, how's life, bro?
Life is amazing, bro. So far, so good. How's yours?
I've been doing good.
You've been doing good, but yeah. I heard you caught dengue, man. How was it?
Yeah, it was pretty bad. Iti नराम्रो थियो यसपालि. I've never got dengue before.
No, but you got COVID, right?
COVID थियो, तर COVID भन्दा dengue चाहिँ एकदमै shitty नै रहेछ.
Touch wood, man. I haven't got dengue. तर dengue को season पनि over भइसक्यो.
Blood pressure especially यस्तो low भइदिँदो रहेछ कि हैन. I think my blood pressure got down to 70/40 or something.
Wow.
Your body becomes so weak and like it just feels like you're dying from inside. It's stupidly worse.
How did you cope, man? How did you cope with that?
A lot of यस्तो भयो, मैले मेरो चाहिँ नि खास इनिशियल डेजमा अलिअलि ज्वरो आउनु बित्तिकै मैले फ्लेक्सन खाइदिएँ कि, अनि मेबी द्याट अपेरेन्टली लाइक फ्लेक्सन
खानु हुँदैन भन्छ नि त डेङ्गुमा.
हुँदो रहेछ, अब ब्रुफिनहरू खानु हुँदैन, नेगेटिभ हुँदो रहेछ त्यसले गर्दाखेरि. So it got a little worse for me, but thankfully I didn't have to go to the hospital. You know, apparently like hospital ma pani यति धेरै मान्छेहरू छ कि बेडहरू पनि नपाउने के पनि नपाउने. Thankfully I didn't have to go to hospital. You know, नेपालमा मात्रै there were 42,000 cases of dengue apparently.
Okay, did your research?
I did my research. Yes.
Pop dog हो कि tough dog हो bro? के research गरेर?
अब yeah, because as हामीले guest बोलाएको पनि यस्तो इन्सपिरेसनल मान्छे हुनुहुन्छ कि जसले हेल्थ इन्डस्ट्री, नेपालको हेल्थ इन्डस्ट्रीमा यति धेरै भ्याल्यु एड गर्नुभएको छ, यति धेरै काम गर्नुभएको छ हैन. So without any further ado, I would love to introduce our first guest of Pop Talk.
So who's our guest?
None other than Dr. Bishal Dhakal.
Bishal Bhai, welcome to our show. Welcome to Pop Talk.
Thank you so much, Prashraya, Raaz, and the entire team around this program. Well, it's weird to be in a pub and be the first guest in a podcast of yours, but it's also a privilege to cut through that stereotype.
Right.
Exactly.
And be bold enough to have a doctor.
Right.
And
exactly.
This is pretty privileged for me, frankly, to be with you boys, as I call both of you guys as my young brothers. Who's been doing absolutely great in whatever you do.
Thank you.
Both of you. And a lot of folks other in the NYEF team and other networks we have. So yeah, I mean, thanks for having me. It's absolutely privileged when Raaz said to me, like, Bishal, we want to get you as an inaugural guest. I said, like, what? How do I fit in? You know? So the thing
we were just discussing if who should we bring in as the first guest of Pop Talk. It was that we were kind of making a list of everybody, and then the first name that
I'm a board topper, man. First time
you are.
The first name.
I got it.
Literally the first name, and literally the first call that we made.
Right.
Oh yeah.
Yeah.
So basically, what happened is your current scenarios are dengue so and you also suffered dengue. And this was in wife company we were together.
Yeah.
So Theo time company we always looked up to you. Okay. He used to suggest us, Raaz तिमी यसो गर, तिम्रो marketing यस्तो गर, and then तपाईले suggest गरिराख्नु हुन्थ्यो नि त. And then to start off, we both thought कि who better than Bishal Dhai, हैन? He's been suggesting us, inspiring us, and more or less blessings as well.
You both been doing good technically, if I see. Prashraya running his digital ad agency, and you running your or dressing us up. Basically, I'm wearing your shirt. You know, I mean, I go every podcast literally wearing this. I'm so proud about it.
Lot. Thank you.
So
Thank you
the
for
thing
doing
is,
that.
yeah, I mean, you guys taught us quite a bit. Like I help you on health or something, or even in entrepreneurship, as you guys said. I might be actually learning a lot from you guys, from the scope of work that you guys do. So it's basically, are we how much open about learning with each other, right? So that's very much under appreciated. So as a Nepali society, we really have this issue with kind of an ego or kind of a knowledge, I say, that we don't have, that we have to collaborate to learn. And that's where these things comes probably naturally on me when I see young people. And
Thank
I really
you so much.
love interacting.
Thank you
what
so
do
much.
you do? How are you doing? Where you come from? Those kind of stuff, right?
Thank you so much. Thank you so much. He's CEO and founder of Health at Home, and there's also another organization apparently called Nepal Angels Network, right? त्यहाँ पनि दाइ चाहिँ नि फाउन्डिङ डिरेक्टर हुनुहुँदो रहेछ, राइट? सो यसैको बारेमा अलिकति कुरा गरौँ दाइ. हाउ डिड एभ्रिथिङ स्टार्ट? हाउ डिड डक्टर विशाल ढकाल become Dr. Bishal Dhakal, as we know? You know that the
Dr.
beginning
Bishal
of
Dhakal
time.
is still a Dr. Bishal Dhakal, right? So to make your life easier, I can go down and share some of my, life's journey, what we've been doing. I come from Janakpur. I was born, brought up there, and probably in every podcast you will hear a little bit about I'm from there.
Right.
I'm absolutely proud about where I belong to. And I was born there. I did my SLC from Janakpur. In between, I had a privilege to come and study in Siddhartha Manasthali. Yes. Yeah, so I threw stones when it was 45, 46 go.
You did?
Yes. I have a story behind it. And then I actually did my SLC from Janakpur. Then I went to India. I did my +2 from Kerala. It was pretty common then to go to India and finish your +2 because it's faster. Then I came back and actually I went to Russia faster than trying in Nepal medical school or try garnu. So I was clear I was going for medical school. There are reasons in my family we have a quite good doctors list in my family, and we were inspired by that. Then I went to Russia and I did my graduation from there. From St. Petersburg. In 2004, I became a doctor, licensed doctor in Nepal.
2004?
2004, yeah. And then I went and first my job was in Dharan. That's called BPKHS, I don't know if you guys know. And I worked in critical care and anesthesia as a house job. So I have a big learning experience, especially on the English language school. And I made quite a bit of good friends, and I actually got to know grassroots Nepali healthcare there. Then I came here and I worked actually in CIVEC. There is a international medical center. So I worked there for 4 years, random, on and off. And by end of 2008, I went to Pakistan, did my cardiac surgery. For residency we call it. So it's a super specialty. It was long course, like 5 years, but I did 2 years and then I quit. So that's where things took a U-turn in my career. I remained Dr. Bishal, but I quit basically a traditional healthcare and moved on to build my own healthcare system.
Right.
It's a pretty complicated.
How did that transition happen? Normally what we see generally is
so
doctor नै भइराख्छ नि त.
Doctor चाहिँ भइराख्ने तर
But then how did the doctor become a social entrepreneur?
Yeah. So very good question. All doctors are social entrepreneur, or all entrepreneurs are in a way some professional. They deliver something, right?
Right.
There is kind of an obscure value on entrepreneurship and service delivery or product delivery. It's a little philosophical. It's a longer talk. But then what I would like to tell you guys is when I quit my cardiac surgery residency, and it was very dramatic, I told my professor that I'm leaving my residency where I was supposed to go and assist in certain way. or get prepared. So he was in shock, but I said like I'm done with it. And there's nothing hidden. And I suffered a lot later on that same year that I was like very much in a pressure to go back and pursue my education. But I determined that I will work outside of hospital. I will create a system where I call it health at home, because for people to be taken care, they need some kind of shilling, you know. Chhana chahiye ni ta. So on that note, I started doing my brand as a health at home, because I cannot go in hospital and work.
Right.
So I picked up.
Sorry to cut you off. तर यो जस्तै हेल्थ एट होम भन्ने जुन नाम र कन्सेप्ट छ नि, दाइले पहिलादेखि नै इन्भिजन गरिराख्नु भएको थियो. हाउ डिड द्याट आइडिया कम अ सिचुएसन, केही न केही त त्यसको ब्याक स्टोरी होला नि कि हेल्थ एट होम भनेर.
Yeah, so I was coming to that.
Exactly.
So when I came out from a hospital, I was determined to create services for people outside of hospital. Whatever happens outside of hospital, I'm going to do. That was my commitment. I will never work for hospital. That's my sankalpa. Okay?
तर त्यो आइडिया चाहिँ कहाँबाट आयो भने चाहिँ कुरा.
So idea is about, see, we were sending patient every time. So I was in critical care in Dhara, and I said like I was working with a lot of people where I was talking to them more often. And I knew there was a pain on people being sick and they couldn't get the services. They didn't know what to manage, how to manage. They were somewhere in tubes, somewhere, you know, urinating in tubes. So they were in difficult condition and they were sent home. तपाईहरु आफै गर्नुस् न भनेर भन्छ के. So on that, I was like kind of getting involved with families and friends and saying to them like you need to get these things. So I saw there was a lot of demand. Not as an entrepreneur, I saw that as a potential area of serving people, and I needed a platform. I needed an enterprise. I needed a vehicle that will solve the problem.
This idea was generated in Pakistan when you were in Pakistan?
Technically, yes.
Yeah.
So I was finding ways to help people outside of hospital, and I could not find ways, and I was doing research, and I found in West there was a lot of solutions like that, which were not pretty much what we are doing at the moment. But then yes, there was a lot of solutions for wound dressing, for nursing, for doctor visitations, for emergency medical practitioners. So there was a lot of things that was happening in West, like in United States, UK, but not what we are doing right now. So it has become a very beautiful product. Now when I see it's a one-stop solution, you call and you get most of the primary care in a go.
Pretty much, yes.
Yes. So that is something that I envisioned, but it took me nearly 15 years to come to this point.
Just coming back to Health at Home and its services, I know. What are the range of services that Health at Home provides? From what I know, from मलाई थाहा भएको अनुसार चाहिँ मैले अहिलेसम्म युज गरेको हेल्थ एट होम.
You tell me what you all use.
कोभिड सुरु भइसकेपछि पीसीआर को लागि युज गर्यो. डेङ्गु भएपछि डेङ्गुको लागि मैले युज गरेको हैन. सो द्याट्स प्रिटी मच इट दाइ हैन. त्यो दुईटाको लागि चाहिँ मैले युज गरेको छु. बट देन अगेन आई जस्ट वान्टेड टु नो लाइक आर देयर एनी रेन्ज अफ सर्भिसेस द्याट इट प्रोभाइड्स. मलाई थाहा भएको अनुसार चाहिँ आई थिङ्क हेल्थ एट होमबाट इफ यु हेभ समबडी सिक इन द होम दे प्रोभाइड यु with nursing at home as well.
So there are 7 services.
Okay.
We do. First is staff placement. Like we do nurse placement, caretaker placement. Then we have doctor visitations. So we have a primary care physicians and we have a consultants on call who can actually, we can hook up to them and then we can coordinate between their hierarchies. Third is we do laboratory workup. Fourth is radio diagnosis and services like ultrasound, echo, ECG. Yes. We have a dedicated team for that.
Yeah.
And then we have equipment rentals where you need a lot of support device like oxygen concentrators, beds. So we set up the things like hospital.
घरमै hospital जस्तो environment create.
So the whole room will change into a hospital, right?
So ICU level पुरै दिन मिल्छ.
ICU level, yeah. So we do have a ICU at home support. So for example, someone is said, कसैलाई चाहिँ ICU बाट ल तपाईको बिमारीलाई अब हामीले हेर्न सक्दैन भन्छ नि हैन. अब भगवानको भरोसा. So we used to say this in different language for different gods, and doctors and medical people would give up at times to save the people. And so that is very destitute. It's very difficult. So त्यस्तोमा चाहिँ we can take up people in any condition and say you're not alone. We can do anything that is up to the level and give them at least a clean, hygienic station. We feed them, we manage their pain, and that's called palliation at home, right? So for that we have a physical therapy, we have doctors, we have nurses, we have carers, we have equipments, we have lab, we have transport support like ambulance and all. So we do coordinate among all these things called 7 pillars of health at home, and actually it is called integrated care model now in a modern medicine. So we basically pioneer on an integrated care model in a developing world. And
यो मोडल चाहिँ नि अरु देशहरुमा चाहिँ छैन.
So it's very expensive. Just because it's Bishal Dai, we have a privilege. Okay? And it is very affordable if you look at the dollar value for the service. Just so तपाईले त्यो कुरालाई तपाईले convert गरेर हेर्नुभयो भने there is almost none institutions in global west.
I mean, like if you have to be in ICU मा राख्नु पर्यो पेशेन्टलाई भने for let's say a month, and the bills are going to be off the roof in Nepal. But then is it substantially नि कम भइदिन्छ?
Yeah, cost of care on a long-term care is still going to be there. हामीलाई पनि पर्छ. तर के चाहिँ हुन्छ भन्दाखेरि the cost of care at home is substantially reduced. And then there are other benefits like the patient is at home, the family can get involved in their own chores. Like someone has to go to the work. A wife has to take care of kids. The patient is in home, so you're kind of your own comfort zone, and you have someone to take care. So the things really becomes comfortable.
Yeah, right. Sorry, I cut you off. Well, I also recently took your service when my granny was sick.
Yeah.
So unfortunately, rest in peace. She passed away.
Yeah.
About a month back. So त्यो टाइममा पनि because everybody were going to work. तर हस्पिटलमा भयो भने अब म हस्पिटल जानुपर्छ, आइसियुमा हेर्न जानुपर्छ, एन्ड अल दोज एउटा हेक्टिकनेस चाहिँ हुँदो रहेछ. तर वन्स हेल्थ एट होमको सर्भिस लिइसकेपछि चाहिँ you're coming back home, you're not going anywhere else, and my granny was still getting taken care of. So that was a kind of easiness पनि थियो.
Yeah, I mean, peace of mind. In a sense, it's a tragic.
Right.
I'm sorry that you lost your grandmom, but how she passed away was she was clean. She was at peace. She was in home.
Yeah.
She was with the family.
Right.
And you guys were going back to your work as a routine.
Right.
That's a privilege we bring.
Right.
And I'm very proud about what I do. And people tell me, "Oh, Bishal, you don't have a care home." I say, "Orkako ghar bhada liera do you think I want to run a business?" No. My business is to take care of your business by giving you a window of that experience, right? You have your home. She was staying till the last second of her life.
Right.
So we bring dignity to people. We bring quality care to people. We have a lot of definitions to it. So we've been awarded multiple times.
Yes.
And as a Nepali citizen, where we are a developing world, we don't have a lot of inspirational projects happening. So fortunately, I mean, I think we should be very proud about what our society responded to our innovation. Like what you guys are doing right now is actually is a pride. Like, on a list of folks, we came in somewhere top because you guys experienced firsthand that Bishal Dai really did good job.
Right.
So the thing is, otherwise the content wouldn't matter. So I think we are successful because of Nepali society.
Right.
And I absolutely own a big time to this society. And I want to give it back. See, I mean, I've been to 6 countries studying. We were counting, and I speak 5 languages.
Off the records. Yeah, I was coming to that languages, so we were actually thinking Bishal Dai speaks 5 languages. So one is English.
Yeah.
Another is Nepali.
Yeah.
Another is
Urdu.
Hindi, Urdu.
Urdu, because you went to Lahore.
Yeah. So so Hindi and Urdu are pretty same.
Okay.
Even Maithili, where I was, Janakpur is they speak Maithili and all. So I speak Russian.
You do?
Yeah. So I studied in Russian language. And I do fairly very good with Spanish because we have a 1 year of a Latin language.
You had to study that as well?
Russia,
so, yeah.
Wow.
So...
This is 2005 you're talking about, right?
Yeah.
Damn.
So long time, yeah. So I'm an old man.
Well, you don't look like one, but then
You keep looking good, right? So,
Like, you've been in health industry for how long? 20 years plus?
no. Actually, I mean, I graduated in 2004, like
2004.
licensed doctor.
Almost 20
and-
years.
Yeah.
Uh,
So, 20 years in healthcare.
Healthcare,
Yeah.
right? Amazing.
So what is the ups and downs that you've seen in healthcare in Nepal, especially?
Well, I mean, public health-wise, we've been excellent. A lot of people have a lot of negative things to say about healthcare. 20 years back, when I saw there was only one medical college which was private. Today, we have quite a bit of it. I went abroad to study, preferably because we didn't have a medical college choices.
Right.
Even if my parents had money, which was scarce then, I think I would have had a choice to study here. So medical colleges, private institutions like nursing institutions, medical centers,
Right.
bed capacity we call it.
Oh.
So we have a cardiac center, we have a neuro center, we have cardiac surgeries, neurosurgeries. We have public health spectrum wise, the way we dealt with, for example, COVID, you can actually measure it among even a developed country, and we have done it excellent. So when you see that, it is pretty much excellent job by Nepali public health professionals. And our vaccination rates, our vaccination compliance, maternal mortality, kids infant death ratio, life expectancy. These are the measures that we see in a public health spectrum.
Right.
But overall ownership of the doctors, the excellence that we have in the house now, like the surgeries, the transplants we do, the complex surgeries we handle. Our past prime minister, ex-prime minister, you call it, right? So KP Oli had his last surgery, which was like after multiple surgeries happened here. So it says a lot about our confidence, right?
Right.
So in my front, in home healthcare or community healthcare or telemedicine or new age healthcare systems, we are pretty far away. I mean, I think we are doing pretty good in a lot of areas which is digitally connected too. Compliances wise, certain areas are lacking, but then I think with these dynamics, we are going to go ahead. So we are pretty way up in the public health and healthcare service delivery capacity. आजको दिनमा हार्ट एट्याकले नेपाली काठमाडौँमा मर्दैन
मर्दैन हो र टेक्निकली
किनभनेदेखि अलिकति यस्तो तलमाथि पेट दुख्यो भने पनि गङ्गालाल पुगिहाल्छ कि सो गङ्गालालको डाक्टरलाई चाहिँ गाह्रो के हो भने ग्यास्ट्रिक भएर आएको नेपालीलाई फिल्टर गर्नुपर्ने गाह्रो क्या
सिम्पटम्स आर सिमिलर हो ग्यास्ट्रिक
सो अलिकति यति अवेर छ क्या सो यसलाई when you think about anecdote, so यो भन्दाखेरि चाहिँ डक्टर विशालले अलि एम्बिसियस भने कि भने जस्तो होइन किन हामी यति अवेर भइसक्यो कि हामीले पानी सफा खाने हात धुने होइन अब यो सबै कुराहरूमा चाहिँ अब अलिकति छाती देब्रेपट्टि दुख्यो होइन रेडिएट भयो भने ओ मलाई हार्ट एट्याक भयो कि भनेर थाहा पाइसक्छ कि सो दे गो सो अन्टिल अनलेस देयर इज समथिङ कम्प्लिकेटेड पिपल युजली डोन्ट डाई विथ हार्ट एट्याक इन दिस सिटी. It's been a while. And I've been saying about this for, so you can be pretty confident about if you land up in random hospital, you'll get EKG, you get a cardiac enzyme, and you know what is happening.
So normally hospitals are recent cases are when people pass away. Unfortunately, when people pass away at hospitals, there are a lot of blames are doctors might answer.
Yeah.
I know people blame doctors. Kune hospital or banda gadera answer to ngamoda bhayera huncha. So health at home ko service ma, has it ever happened that you guys been blamed?
Yeah.
And how do you tackle with that?
Well, I mean that's
blamed in the sense कि तपाईँले राम्रोसँग टेक केयर गर्नु भएन
Yeah. So,
हस्पिटलमा पनि हुने त त्यही नै हो.
यस्तो हो अब we are very conservative in a lot of things. So we spend a lot of time in counseling, what kind of services they need, and we are always hands-on. So we don't have a lot of cases. We are not like open-ended like hospital. So you just don't bars in our system and say, I want it. We select also.
Oh, you sell it to clients.
Okay.
Oh, we are not like random. No, nobody can get it.
So दाइ हाम्रो यो हेल्थ एट होमको सर्भिस चाहिँ इज इट ओन्ली लाइक सेन्ट्रिक टु काठमाडौँ एरिया राइट नाउ?
No, we have in Pokhara, we had in Chitwan, we had in actually also in Delhi.
Also in Delhi.
Yeah, so we
What is the team size,
attempt, you know. I mean, like we've not been successful yet, but we want to be in areas where Nepali are present. So we work for our community, but our consciousness is about being there where it matters.
So indirectly
That's an ad hoc basis ma doctors and nurses haru त्यो गर्नुहुन्छ कि are they salaried within your organization?
There's a complex architecture in it. Yeah, so it's basically all of our staff are contracted. All of them are in not in payroll, but there is a system that governs it. And then there is a set of people who work for us, who's a payroll. Yeah, there's an architecture now. It's complex.
If I may ask, what is the size of the team that you have right now?
We go anywhere. So the lowest that we had during COVID, because we cannot do elderly care by exchange people. So highest we had was 150 patients before COVID, and we went down up to 25 people recently when COVID opened up. So we didn't add much of patient because if we take up patients...
Patients भन्नाले हजुरको
inpatients हाम्रो घरमा भएको patientsहरुको नम्बर
हैन तर मैले तपाईको टिमको भन्नु खोजेको मैले टिमको साइज भन्न खोजेको.
So हाम्रो टिम अहिले around 50.
It's gone down to 50 because last time
in-house
it was 200 plus.
Yeah, so out-house always expanded. So it's basically, you can talk about today, health at home is 150 workforce. And 50 is in-house. Yeah.
So there's no other companies that work under the same business model as health at home in Nepal, right?
Quite a bit.
अहिले कोही पनि छैन.
No, many.
No,
there's so we've been in market for 15 years. There were none in Delhi when we started. Okay, there was none in India. I'm not kidding. So we are easily South Asian pioneer. We're easily Asian pioneer. I know, and we are proud about what we did in this valley. You know, and when people come and work and they see there is a scope, and then they see there is a livelihood around it, people definitely copy you.
Yeah.
And I stopped growing, you know, because there's a lot of copy models which is there. But my argument with a healthcare system as a hospital, I always said, you know, one day none of the patient will have to go home empty-handed. They will have a choices in their feet, waiting for people to be empowered. My goal was different. I'm not doing this to become rich. I'm doing this to challenge a system which was dry, which didn't have a help for the people. When they go out from the hospital, there was nonsense like, you know, you have to go to the lab, give a sample, then you have to go and collect the report, then you have to go and show the doctor. I said, like, shit, like, hold on, let's sort it out, you know. There's an 8-year-old guy going and sitting and waiting for a primary care doctor for 6 hours. It's sick.
I know.
The system is sick.
Right.
So
for my challenge as a Bishal Dai, if you say, tomorrow there will be a brighter side that every patient has a choice. You know, you can do tests, you can do doctor calls, you can do, you know, someone can come and take care of people. You have choices of people. Empowerment, right? It's a patient empowerment. So I was in a way rebel in a system, or I was an activist who thought about that idea to convert to industry to be an influencer. Today, I'm an influencer. Easy, right? So I'm in my zone.
Right. So अहिले हामी कुरा गर्दा गर्दै भर्खर मलाई के रियलाइज भयो पनि हामी बोल्दा बोल्दै धेरै अंग्रेजी बोल्दा रहेछौँ के.
Oh, you guys drag me into that. हामी अंग्रेजी पढाउने च्यानल पनि हो भन्ने के.
त्यसको लागि I think that's a great idea. We can do another separate podcast.
Yeah, so
come learn English from us.
Yeah. I think it's because हामीले धेरै त्यो के अरे इंग्लिश पडकास्टहरु धेरै सुनेर हुन्छ नि त.
Right. त्यो एउटा इन्फ्लुएन्स पनि हुन्छ.
Automatically हामीले पडकास्टको अगाडि आउने बित्तिकै we start to sort of.
No, I'm not. See, I will not be shying away by saying I write my prescription in English. I went to English boarding school since my kindergarten. That was 35, 40 years back.
Right.
So I'm born to think in English. Nobody can take away. तर एज अ कन्सियस पर्सन I mean, we have, हामी नेपाली पनि बोल्न सक्छौँ, बोल्छौँ, युज गर्छौँ, तर मेरो त पेसाले पनि मैले त मेरो जर्नल इङ्ग्लिसमा, मेरो पेसेन्टको प्रेसक्रिप्सन इङ्ग्लिसमा, म त एभ्री डे प्यारलल क्या. सो प्लस अब हाम्रो लाइफस्टाइलै त्यस्तो छ होइन. अब त्यसमा चाहिँ अब आइएम सरी बट हाम्रो ब्रान्डको नाम पनि इङ्ग्लिसमै लेखेको छ. सो हाम्रो हेल्थमा चाहिँ हामी इङ्ग्लिसमै सोध्छौँ, इङ्ग्लिसमै गर्छौँ खास चाहिँ. अब त्यो विडम्बना हो. अब तर त्यो दुःख अब हाम्रो भनौँ न आम जनताहरूले त्यो कुराहरू चाहिँ साँच्चै नै दे सफर. किनभने यो डिस्प्यारिटी, यो जुन खाडल हुन्छ त्यो बढ्दै जान्छ. तर उहाँहरूले पनि अङ्ग्रेजी सिक्नुपर्छ होइन. अङ्ग्रेजी सिक्नलाई पनि यो माध्यम बन्न सक्छ. यो कुरालाई चाहिँ म माइनस गर्दिनँ, तर एउटा नेचुरल फ्लो हो, यो कन्भर्सेसन हो. यसमा हामीले धेरै सोच्नु जरुरी छैन. यो त हाम्रो कन्टेन्ट लाइक यसमा मैले अङ्ग्रेजीमा किन बोल्ने, नेपालीमै बोल्यो देन हामी त अङ्ग्रेज पबमा छौँ नि होइन.
Of course.
So
how could we forget?
यो चाहिँ आइरिस पब हो. अनि आइरिस पब र ब्रिटिस पबमा पनि फरक हुन्छ.
Of course.
अलिकति प्रमोसन है.
अनि अब मलाई तिमीले त्यसरी भन्यो भनेदेखि त मैले फेरि
यो पर्टिकुलर आइरिस पब चाहिँ होइन, it's the only authentic Irish pub in Nepal.
I mean I agree.
All these you have from Ireland itself.
Yeah, I was very proud when you guys took it over. मैले एउटा चाहिँ अब इन्डियन रेस्टुरेन्टमा गयो भने के हुन्छ, एउटा इन्डियन मोटिभ हुन्छ, नेपाली होइन, नेपाली भयो भने नेपाली मोटिभ हुन्छ. जस्तो थकालीको सो देयर इज लाइक अ प्ल्याटर, देन देयर इज अ सेट, देयर इज अ स्प्रेड. सो एभ्रिथिङ म्याटर्स. अब जस्तो जापानिजमा गयो भने यु निड अ काइन्ड अफ जापानिज एम्बियन्स. सो एम्बियन्स मात्रै होइन, यहाँ यो त कस्तो छ भनेदेखि दिस इज वान अफ माई फेभरेट प्लेस. In a sense, like I might not be frequenting, तर कस्तो हो भने ambience wise आइरिस अथेन्टिक लुक छ. दिस इज गुड एम्बियन्स इन अ सेन्स. यो आयरल्यान्डको एउटा पिस जस्तै छ. अब हामी कहाँ बियरको चोइसेस छैन. अब तिमीले चाहेर पनि यु डोन्ट ह्याभ द्याट लग्जरी टु अफर टु द क्लाइन्ट. सो द थिङ इज आई थिङ्क यु हेभ मोर चोइसेस विथ न्यू बियर ब्रान्ड कमिङ इन. सो अब कोही पनि स्कटल्यान्ड गयो भने विस्की खान्छ, आयरल्यान्ड गयो भने देयर इज लट अफ चोइस अफ बियर एन्ड अल. सो द्याट्स कल्चर के. अब हामीले त्यो पाउनु भने त आइरिस बार यस्तो हुन्छ भनेर मान्छे आउँछ नि त. अब आइरिस बार पनि थकाली जस्तो, थकाली पनि आइरिस बार जस्तो हुँदैन नि त. सो इट्स ओके.
Exactly. So we're trying to do some new stuffs here. अनि टिम पनि त्यही हिसाबले सोचिरहेको छौँ. कामहरू पनि त्यसै हिसाबले भइरहेको छ. प्रमोसन्स पनि. By the way, we had a comedy session yesterday.
Oh,
yeah. Like first time ever got
last night.
Amazing show.
How was the turnout?
I think we had more than 150 people. It was ticketed event. I know.
Oh, that's a good one.
Ticketed event ma we were supposed to sell only about 70 tickets, but then door sales pani high bhaidiyo ke.
Congratulations.
Thank you, thank you.
So when you're able to sell something, it's always good.
Yeah. Sales ko kura garda I have a question.
Yeah.
जुन तपाईँले फर्स्टमा तपाईँको कार्डियक रेजिडेन्सी गरेर राख्नुभएको थियो होइन, त्यसपछि नेपालमा त्यही बेलामा हेल्थ एट होमको आइडिया आयो भन्नुभयो तपाईँले. सो डक्टरी भन्दाखेरि ट्रेडिसनली जाँदाखेरि चाहिँ हामीले प्रोभाइडिङ सर्भिस हो नि होइन, फर ह्युमन वेलफेयर होइन र. त्यो टाइममा अब वेन यु बिकम अ डक्टर यु स्टार्ट चार्जिङ फर यर सर्भिसेस होइन. अनि तपाईँको एउटा इन्टरभ्यू पनि हेरेर थियो वेयर यु से मान्छेहरू के बाहिर गएर पढेर आउँछ, सबै बाहिरको सिकेर आउँछ, तर यहाँ सर्भिस दिने बेलामा चाहिँ नेपाली सर्भिस दिन्छ, इभन डक्टर्स होइन. तर त्यो टाइममा एउटा के भन्छ रिबेल भएर यु सेड ओके आम गोना गिभ अ डिफ्रेन्ट काइन्ड अफ सर्भिस एन्ड आम गोना चार्ज लाइक वाइज होइन. नट हस्पिटलको कम्पेरिजनमा त जाँदैन, बट देन अगेन आम गोना चार्ज लाइक वाइज. यो एउटा ब्रुटली नै भन्नुभएको थियो तपाईँले एउटा इन्टरभ्यूमा, म सर्भिस दिन्छु तर यु हेभ टु बी एबल टु पे फर माई सर्भिस होइन. एन्ड देन इट कस्तो मलाई अफ गार्ड लियो जस्तो लाग्यो. आई वाज वाचिङ द इन्टरभ्यू अनि मलाई कस्तो अफ गार्ड लाग्यो कि होइन, बिकज मैले त्यो साइड हाम्रो पहिला कुरै भएको थिएन नि त त्यो साइडमा होइन. अनि त्यो हेरिसकेपछि मलाई एउटा कस्तो एउटा रियलाइजेसन भयो भने एभ्रिथिङ हेज अ प्राइस होइन. यु पे फर एभ्रिथिङ
until government takes full ownership of it.
Right.
तर नेपालमा त्यस्तो फ्री हेल्थ केयरको त्यस्तो केही पनि नै छैन नि
छैन
है. एभ्रिबडी हेज टु पे फर देयर हेल्थ केयर.
इभन हेल्थ पोस्टमा जाँदाखेरि पनि यु हेभ टु पे.
There are things that is for free. There's a government thing nowadays for government program 70 देखि 90 वटा औषधिहरू चाहिँ कति फ्री छ. Primary healthcare systems are free नै हो.
Right.
तर technically when you land up in a public hospital there is some kind of a consumable, durable medicines that is not there. They have to rush to get अब हामीसँग यो सप्लाई छैन भन्ने खालको आर्गुमेन्ट्सहरू रिफर गरिदिने प्राइभेट हस्पिटलहरूमा होइन. त्यसले गर्दाखेरि भिक्सस साइकल अफ द्याट कन्ज्युमरिजम या मार्केट बेस्ड इकोनोमीको एउटा इम्प्याक्ट चाहिँ पब्लिक सिस्टममा परिरहेको हुन्छ. पब्लिक सिस्टममा परेको होइन, पब्लिकलाई परिरहेको हुन्छ. सो यु ल्यान्ड अप इन से टेक्निकली मैले काम गर्दाखेरि वीर हस्पिटलको इमर्जेन्सीमा तपाईँलाई सिटामोल किन्न लेखेर पठाउने भन्नेसम्म गरेको हो मैले नै. मेरो साथीहरू धेरैले गरेको छ. सो त्यो त हेल्थ केयर सिस्टम होइन नि त. सो मेरो सिस्टमको सोचाइमा चाहिँ बिरामी घरमा भएको बेलामा एटलिस्ट मैले पैसा चार्ज गर्छु, तर बिरामी भएको बेलामा मैले एडभान्स चाहिँ लिन्न. सो हेल्थ केयर डजन्ट ह्याभ अ एडभान्स सिस्टम.
त्यो पनि सुनेको थिएँ दाइ मैले.
या सो म सर्भाइभ गर्छु कि गर्दिनँ वाज अ क्वेसन एन्ड एभ्रिबडी आस्क्ड. सो मेरो अफिसमा तपाईँले फ्रन्ट डेस्कमा बिलिङ सिस्टम देख्नुहुन्न. रिसेप्सन हुन्छ, बिलिङ हुँदैन. बिलिङ जहिले पनि काम सकिसकेपछि मात्रै हुन्छ र महिनाको अन्तिममा हुन्छ. भनेको मेरो एक्सपेरिमेन्ट्सहरू मल्टिपल एरियामा सो रेबल हो होइन कि पेमेन्ट सिस्टममा आइएम आर्ग्युइङ द्याट यु डोन्ट ह्याभ टु पे इन द डोर, यु गेट द सर्भिस फर्स्ट एन्ड पे लेटर.
त्यसलाई चाहिँ नेपालको जुन अहिलेको कन्टेक्समा हस्पिटलहरू जसरी रन हुन्छ त्यो केही पनि नै चित्त नबुझेको जस्तो लाग्छ. द्याट्स वाइ यु स्टार्टेड योर ओन सर्ट अफ सिस्टम एन्ड
आई मिन राइट, भेरी राइट. तर सिस्टम मन परेन भनेर इन्टेलेक्चुअलहरूले चाहिँ गएर भचाउन मिल्दैन. हामीले बनाउने हो, देखाउने हो अनि हामीले सिकाउने हो होइन. सो देख्दै नदेखेको, हुँदै नभएको कुरा, बुझ्दै नबुझेको कुरालाई हामीले गलत भनेर आर्ग्यु गरेर रेबल भएर मात्रै हुँदैन. हामीले गर्ने कोसिस गर्ने कुरामा समाजमा रूपान्तरण सम्भव छ भन्ने कुरा भन्ने हो. विच इज लाइक इन इङ्ग्लिस इफ आई से द ट्रान्सफर्मेसन ओन्ली ह्यापन्स इफ यु पुट एन एटेम्प्ट अन इट. It doesn't happen overnight.
Right.
So that 15 years of health at home is now engraved in Nepali society that nobody can take away, as a privilege of the patient should be guaranteed. Either by the market or by the individuals or by the government.
But don't you think like कि अहिलेको टाइममा जति पनि अहिले हस्पिटल्सहरू बनिरहेछन् नेपालको कन्टेक्समा हेर्ने हो भने त होइन, आई डिड अ लिटल बिट अफ रिसर्च. त्यसमा चाहिँ नि मैले के what I found was there are not even enough hospitals and beds in Nepal to accommodate whenever it comes to epidemic or pandemic. होइन त्यस्तो केसमा यो हस्पिटल्सहरूले पनि दे चार्ज एक्स्ट्राभेगेन्ट अमाउन्ट अफ मनी होइन. सो
वेल आई मिन
बिजनेसको रूपमा लिइरहेछन् कि क्या हो हस्पिटलहरू बनाउनेको लागि, कि प्रफिटेबल हुनुपर्ने यस्तो खालको के. एन्ड द्याट्स वाइ देयर इज अनदर फेरि त्यो पनि गरिरहेको हुन्छ नि त. मान्छेहरूले ब्लेम पनि लाग्दैन, यो हस्पिटल महँगो छ, यो हस्पिटल महँगो छ, सस्तो हस्पिटलमा हस्पिटल पनि होटेल जस्तो इन्भाइरोमेन्ट क्रिएट गरेर. हस्पिटल त खास भन्यो भने जेनरल पब्लिकलाई सर्भिस दिनलाई बनाइएको इन्स्टिट्युसन हुनुपर्ने थियो नि त. आई थिङ्क इट इज टेकन मोर एज अ बिजनेस. Do you think it's taken more as a business or it's like...
It is a business. Okay, either it's a business of government or it's a business of public. So public business हुने बित्तिकै एन्टरप्राइजेसहरूले गर्छ, गभर्मेन्ट बिजनेस हुने बित्तिकै ट्याक्स पेयर पैसामा हुन्छ होइन त.
तर एउटा कस्तो भने आरोप पनि लागिरहेको हुन्छ नि त कि यो हस्पिटलमा गयो भने त के अरे फर्स्टमै भयोभरको सबै टेस्ट गराउन लगाउँछ एन्ड देन दे चार्ज बिल्स आफ्टर बिल्स भनेर. त्यस्तो पनि गर्छन् र एन्ड एथिकली पनि त्यस्तो गर्छन् र दाइ.
यस्तो हो, इफ यु गेट डिपर इन्टु हेल्थ केयर सिस्टम एन्ड कम्प्लेन अबाउट इट, प्रोबेबली इट विल बी little too complicated for you guys to get involved.
Just as a layman,
but as a citizen, but as a young person, and but as a growing person who needs to get healthcare services, you do definitely have a right to ask these questions. I know. So when you ask these questions, it's a very simple question that you're saying, do you think it's highly commercialized? You know. So I'm just saying yes. It gets commercialized when you land up not knowing where to go. And that not knowing where to go actually makes you pay double for the same service. And to have that filtered out is a process. And that we don't practice as a public. So you don't probably have your primary care physician, do you?
No.
That's the answer. So we don't have a system to go to the primary care physician to ask where to go, because he should take a custody of yours. And that's where the West has a privilege, and East doesn't have a privilege. If you have a blood pressure, you go to cardiac surgeon. If you have a eye problem, you go to Tilganga's chief. You don't wait for your primary care physician to tell you and navigate the right thing for you to do. You don't believe them. So the societal structure.
Hospitals are charged primary care services.
No, it is absolutely cheaper than a lot of developed country. The only thing is we'll end up paying double, triple for the same shit, because we'll end up going round and round for getting a right treatment. So for example, you have an eye pain. You'll end up thinking, Mera aakha dukhe ma gaye. Maybe you have an eye pain because of other problem. And you'll end up going to Tilganga, pay one round of consultation and checkup. Then you go to neurosurgeon, and then you pay up another round, and then probably you have something third that you don't know, and then it's probably a different thing. What happens? You pay 3 times and you say, damn, it was so simple, I paid 3 times. So cost of care once हामीले. So it's basically cost of...
That's not even covered by insurance plan. बाहिरको देशमा त every service that you take...
but you will not go land up in Tilganga without asking an insurance guy. Or a primary care physician's recommendation has to be organized, and there's accountability on it. That primary care physician takes on all the referrals, is actually converted into an actual diagnosis which is going to be accountable. So त्यो त साइन्स हो नि त, त्यो त हामी कहाँ के पनि छैन हैन.
नेपालमा त्यस्तो खालको प्रोसेस नै भएन.
ओ सो के हो भन्देखि
गभर्नमेन्ट लेभलबाट नै यो के अरे इनिसिएट नभएकोले नै यस्तो भइरहेको छ. किनभने अब दोज हु क्यान पे दे क्यान पे, दे विल गेट द बेस्ट अफ हस्पिटल्स, दे विल गेट द बेस्ट अफ सर्भिसेस द्याट दे निड हैन. तर मोस्ट पिपल डाई बिकज अफ ल्याक अफ हैन. त पैसा नभएर हुनसक्छ कुनै अब
there's a lot of reasons.
Yeah.
Right? So sad part is
so if insurance had covered it, अथवा उहाँले सबैजनासँग हेल्थ इन्सुरेन्स भइदिएको भए, they could have at least been in a good hospital, or maybe I don't know.
No.
Is there something called good hospital and bad hospital? That's also my question again.
Well, I mean, I think there is always there's always a good... Medical professionals usually are good, 95% I can say, because they all study good things, right? How to take care of people, what body is built about, how to take care of the sick people, how to help them recover. But when it comes to practice, that is a problem in the society. What I told in other interview, that we study a Western book and practice in Eastern way.
Right.
Which means when you practice, you want to have a queue outside which is like 150 people waiting for you.
Yeah, exactly.
That's sick.
Exactly.
That person is not practicing according to what he has studied or she has studied. You need to take care of individual patient as an individual,
right?
Not as a mass,
right?
So that's where things starts getting wrong, because you are inspired by becoming that macho. I can fix the world. No, that's not the point. So the thing is, we need to step back. We need to think system-wise. We need to think where we fit in, and there's a lot of room. Actually, we are actually still sort of like, say, around 20,000-30,000 doctors. We are still sort of like 40,000-50,000 nurses. So there's a lot of room.
Actually, नेपालको केसमा त अझ के अरे मैले यसो हेरिरहेको थिएँ हैन, 1:1724 रहेछ के. Okay, 1 doctor for 1724. तर WHO अनुसार हुनुपर्ने चाहिँ 1:1000 is apparently. So we are very short of doctors apparently.
How much?
Quite a few thousand. Coming to that, हैन, नेपालमा यति धेरै डक्टर्स एन्ड नर्सेसहरूको कमी रहेछ, तर why do you think we are not being able to produce that many doctors? And is it because the education is very expensive, or is it because नेपालमा धेरै doctors and nurses हुने interested नभएको मान्छेहरू हैन?
Your question is not coming out direct, man.
Are we producing a lot of dumb people is what I'm saying, not doctors.
Yeah.
Too many businessmen around, हैन? सबैलाई entrepreneur हुनु छ, सबैलाई के हुनु छ, तर डक्टर हुन्छु भन्ने खालको त किनभने मार्केटमा त ग्याप रहेछ नि त. हामीलाई त साच्चै धेरै डक्टर्सहरू चाहिरहेछ नि त. Are they going away from Nepal?
It's very demanding.
Or is it because नेपालमा राम्रो के अरे एकदम एक्सपेन्सिभ छ कि
हैन? त्यो टाइमलाई हेऱ्यो भने, कुनै पनि टाइमलाई हेऱ्यो भने, you can always find a lot of excuses like expensive, or I'm telling you, I went to Russia because there was only one private medical college, which was Nepal Medical College. As we have around 10-15 private medical colleges with everyone holding around 100 new admissions, which is like 1,000 plus every year productions in pipeline. त्यो हुँदाखेरि चाहिँ हामीले 10 वर्ष 15 वर्षमा कति लिप बाउन्ड गर्यो भने फड्को मार्यो भनेदेखि देयर इज लाइक अ ह्युज प्रोडक्सन प्रोसेस एन्ड वी आर एक्चुअली नट ओन्ली प्रोड्युसिङ फर आवरसेल्फ वी हेभ लट अफ नेपालीज गोइङ टु युके
China,
US, no, practitioners.
Practitioners.
So the good cream of this whole profession are giving USMLEs and professional exams out there. They qualify to actually work in United States and UK and Australia, Canada. अनि उनीहरू त्यो जुन क्वालिटीको manpower छ. These are Nepali people. They are Nepali kids, you know. They are my friends, and so we are world class. We are world-class nurses. We are world-class doctors. We are very hardworking, very industrious, very skillful. The only thing is why I said our public health system is amazing is because what we study is a global standard, like what dengue is, what typhoid is. We study same book as what someone studies in London or New York. But when it comes to practicing or improving the system, we're not invested in it.
Right.
And the only difference between Dr. Bishal and other probably you'll find is I'm invested in changing it. That's the fundamental thing. What you find a change between me or some other doctor practitioner is I'm invested on changing the thing that is I feel is not right. So I'm committed to it. I'm committed to Nepali society. I'm committed to Nepali professionals. I have been through a lot of difficult time, but also we have seen a lot of bright side of it. That the results possible, that we can change things. Today nearly 10,000 nurses work in the sector that I opened up.
At health at home?
In sector.
Yeah, okay.
So home healthcare sector has a multi-tiered. So now you can say maybe 100 of agencies are there.
Exactly.
Right?
Data.
And then there is always a doctor available, equipments available, nurses, labs. So that whole workforce that work in those sector, that Pandora's box was opened by one idea.
Exactly.
So when you think about those kind of process or investing yourself, there's quite a bit of champion. I mean, I'm not the only one. So you can say Dr. Sandukruit is there, Dr. Bhavan Koirala, our reputed sirs, and then there's a lot of
apparently Bhavan Koirala is #1 doctor of Nepal.
Yeah. No. He's very well known. He's reputed, and there are other doctors like you can see in kidney specialists like.
What defines being #1 and #2? Like all doctors are doctors. No?
There is no doctor.
There is हाम्रो घरमा हुन्छ नि त यो डक्टर भन्दा त त्यो डक्टर राम्रो छ नि त भन्ने
layman.
No.
Just layman question there,
No, it's not layman. It's individual choices. So कसैलाई कसको बोली मन पर्छ, कम्युनिकेसन मन पर्छ, पर्सनालिटी मन पर्छ, इम्प्रेसन मन पर्छ. अब उसले देखिरहेको हुन्छ टिभीमा I like that guy, I want to be seen by him or her. There are a lot of legendary, amazing professionals like तपाईँले maternal child health ma kaam गर्ने, there are legends who have done remarkable work. There are people we have done in eye, we have done in orthopedics like Dr. Baskota who created B&B Hospital. He's amazing. I mean, Vaidya sir, he's amazing. They have created a benchmarks.
But then what I was trying to say was normally त्यस्तो हुन्छ नि त अनि के अरे गुगल गर्दाखेरि हैन लाइक who's the best doctor in Nepal and the #1 doctor of Nepal is Bhavan Koirala. So how can that happen? Who's ranking all the doctors?
No, he's pretty popular. I mean,
in terms of popularity,
I'm a big fan of him. So the thing is, like, he is champion for us. I mean, he's a champion. किन हामी कहाँ कस्तो छ भन्देखि हामी जहिले पनि बाहिर हेर्छ के हामीले आफ्नो च्याम्पियनहरु बनाउन सिक्दैन छ अलिकति बोल्डली भन्छ हामीले जस्तो अब अहिले हामीले हेल्थ केयरमा भवान सरहरु जस्तो अझ चाहिन्छ they make things, I mean, he made Gangalal, he made Manmohan, he made Civil, he's making child hospital.
Okay.
He's not a kid. I mean, like, he's done things, in our field. So हामी कहाँ कस्तो छ भने you're praising someone, It means, either you're weak or you're something who's like, you're running behind him or pestering. No. I'm very open about the people who created Tilganga, like Dr. Rohit. He's a legend. He's amazing. Like, millions of people to give a sight is not a joke. He's a Nepali guy. He's a phenomenal. And for global repute and impact. And so त्यस्तो कुरा चाहिँ हामीले आफ्नो च्याम्पियनहरु यही हेर्ने हो के अनि हामी कहाँको त्यो कमजोरी चाहिँ कस्तो भने वी काइन्ड अफ गो एन्ड ट्राई टु लुक वेयर उहाँ भन्दा त उहाँले राम्रो गरेको हैन
फ्यामिली रेकमेन्डेसनमा धेरै
अनि त्यो चाहिँ हामी कहाँको कमजोरी पनि हो र हामीले त्यसमा I want you guys to be champion for my kids, like how? And you got to do something phenomenal, right? So that I can say, hey, this is Prashraya uncle. Think about it, like he's been there, he's done it. And now you got to go and follow him or Raaz and then, learn few things from them. That's where we change our society. And it's not going to overnight.
Yeah. So coming back to healthcare of Nepal, I just feel like नेपालमा चाहिँ धेरै मान्छेहरूलाई आई फिल कि इमर्जेन्सी हेल्थ केयरको बारेमा धेरै ज्ञान पनि छैन अनि हाम्रो नेपालको इमर्जेन्सी हेल्थ केयर त्यति स्ट्रङ पनि छैन जस्तो चाहिँ मलाई लाग्छ हैन एज अ लेमन आइ एम स्पिकिङ हैन सो व्हाट डु यु थिंक दाइ
लेमन भन्दा पर्सनल कन्सर्न
भनौँ मेरो एकदम पर्सनल कन्सर्न चाहिँ किन छ भने राज हैन किनभने स्पेशली व्हेन इट कम्स टु मास क्याजुअलिटिज or कुनै रोड एक्सिडेन्ट भयो अथवा केही त्यस्तो भयो भने पिपल डु नट नो हाउ टु डु लाइक इमर्जेन्सी प्रोसिजर्सहरू के होइन वरिपरिको मान्छे जस्तै फेरि मेरै पर्सनल इक्जाम्पल चाहिँ कस्तो छ भन्दाखेरि मेरो बुवाको के अरे रोड एक्सिडेन्टमा डेथ भएको हो क्या दाइ सो त्यति बेला चाहिँ के भने ट्याक्सीले हान्यो होइन त्यसपछि वीर हस्पिटलमा ल्याउँदाखेरि टाउकोमा लागेको रहेछ तर दे ब्रट हिम इन ट्याक्सी एन्ड देन के अरे स्ट्रेचरमा राखेर ल्याएको छ कि स्ट्रेचर के त्यो विल चेयरमा नट इभन स्ट्रेचर होइन सो त्यो इमर्जेन्सी हेल्थ केयर हुन्छ नि मान्छेहरूसँग त्यस्तो खालको नलेज भइदिएको भए मेबी इट वुड हेभ बिन अब इट्स जस्ट अ होप राइट कि के हुन्थ्यो कि जस्तो लाग्छ कि मलाई आजसम्म पनि
हाउ मेनी इयर्स ब्याक
अबाउट 10 years ब्याक दाइ सो त्यति आई थिङ्क के अरे एक्सिडेन्ट भइसकेपछि के गर्नुपर्छ भन्ने कुराहरू हामीलाई पनि होइन हामीलाई पनि त्यतिको नलेज चाहिँ छैन नि त अब हात भाँच्यो तर कहाँबाट के गर्ने कसरी प्रोटेक्ट गर्ने भन्ने खालको त्यो इमर्जेन्सी हेल्थ केयर हुन्छ नि एउटा र त्यति बेलाको प्रब्लम चाहिँ कस्तो थियो भन्दाखेरि एम्बुलेन्सको प्रब्लम के अरे हस्पिटलमा भेन्टिलेटर नभएको प्रब्लम इट वाज नट इभन अर्थक्वेक नट इभन एनिथिङ होइन हस्पिटल टु हस्पिटल दौडिनु पऱ्यो 1 बजे भएको एक्सिडेन्ट 7 बजेसम्म त वी वर रसिङ फर भेन्टिलेटर के सो for 7 hours, I mean like for 6 hours straight, and we were just running around here and there, just trying to find a ventilator and त्यो गर्दा त्यो प्रोसेस नै यति लामो भइदिँदो रहेछ क्या आई थिङ्क मान्छेहरूसँग नलेज नभएर पनि र त्यो इमर्जेन्सीमा हुन्छ नि एम्बुलेन्स आइहाल्ने र त्यसमा रियाक्ट गरिहाल्ने जुन बाहिर हामीले अब आई डोन्ट नो लाइक मुभिज एन्ड सिरिजहरूमा हेरिरहेको हुन्छौँ त्यस्तो खालको फास्ट सर्भिस पनि नेपालमा चाहिँ छैन जस्तो लाग्यो कि कसैलाई केही भइहाल्यो भने आफ्नो घरमा यु विल ह्याभ टु बी you will have to know the doctors, you will have to know the hospital को somebody, right? एम्बुलेन्स को फोन नम्बर पनि आफै पत्ता लगाउनु पर्ने होइन सबै कुरा आफै गर्नुपर्ने रहेछ नि त नेपालको केसमा त होइन अनि प्लस के अरे मलाई अर्को चित्त नबुझेको कुरा अर्को पनि के थियो भन्दाखेरि इफ समथिङ ह्यापन्स यु गो टु द हस्पिटल नाउ दे विल राइट यो औषध चाहियो भने यु हेभ टु गो एन्ड रस एन्ड बाई एभ्रिथिङ कम टु त्यो हुन्छ नि त स्पेसली अब राम्रो ठुलो हस्पिटलमा त त्यस्तो नहोला होइन तर नर्मल मान्छेहरूलाई भनौँ न त्यस्तो हस्पिटल अफोर्ड गर्न नसक्ने मान्छेहरूलाई त दे विल बी रसिङ हियर एन्ड देयर त्यो प्रोसेसमा नै त्यो पेसेन्टलाई के भइसकेको हुन्छ थाहा नहुने खालको सिचुएसन मैले फिल गरेँ त्यति बेला चाहिँ होइन आई डोन्ट नो हाउ इट इज राइट नाउ
यो सब प्रशयको अहिले जुन
मेरो फ्रस्ट्रेसन हुँदा यो
फ्रस्ट्रेसन आइरहेछ नि
मेरो त पर्सनल एक्सपिरियन्स हो नि त्यो त
किन लागिरहेछ विशाल दाई इज अ बिट लिङ्क टु गभर्मेन्ट पनि जस्तो लागिरहेछ बिकज यो फ्रस्ट्रेसन गभर्मेन्टलाई सोध्नु पर्ने तपाईँलाई सोधिरहेछ
आइम कमिङ टु द्याट मेरो पर्सनल प्रब्लम चाहिँ नेपाल जस्तो
कम्प्लिटली अन्डरस्ट्यान्डेबल
नेपाल जस्तो आइम नट सेङ नेपाल ओभरनाइट चेन्ज हुनुपर्छ एन्ड अल बट वाट आइम ट्राइङ टु से इज मान्छेहरूसँग इमर्जेन्सी हेल्थ केयरको नलेज चाहिँ छैन जस्तो लाग्यो मलाई चाहिँ त्यो होइन मसँग चाहिँ छैन समथिङ ह्यापन्स आई डोन्ट नो व्हाट टु डु
फर मी let me try to answer as brief as possible. And plus, the thing is, it's so personal. And usually, healthcare crosses your life when it's personal. Right. I know. Right. You talked about your grandmom. You talked about your dad. It is not replaceable. That it's sad. I know. तर we learn lesson like your expectation as a citizen. You're saying,
exactly
what medical field is doing for it, and how fast we are going forward on it. I'm very sad that you told me about you losing for running around finding a airway management process for a sick person who was in accident. You're talking about your
exactly
dad, right?
Beer hospital ma ta ambulances number tasik and
So
you have to call every number and figure out which ambulance, and pray to God ki kasale phone uthayera ma
So we have this new thing. I don't want to say this is absolutely tragic. I can sense your vulnerability when you talked about it. And I absolutely feel as a practitioner also what you have, and also as a person I see, and that's what I personally have seen and suffered, and I hate this experience. What you're going through, I hate it, and I don't.
And a lot of people are going through the same kind of stuff.
No, here's the thing. See, I cannot change the whole world, but at least I can put an attempt where I think that things are wrong. But there is something which is positive that is happening. Is called 102, which is like a single centered based ambulance service, which is paramedic led. Is in Nepal. Now it is like so he's leading it in a smaller version, but then it started way when we started talking about it, and there was a group of people who actually led it. So in some way I'm linked to it in that evolution. But then there was other thing that we did during COVID, which was called Nepal Ventilator Bank. So that's unique in a sense. Like, I hate when people are transferred from hospital to hospital. So I said, aba manche lai transfer hudaina, machine transfer हुन्छ. So that was idea.
Great work there.
So the thing is, I hate personally saying, like, for machine you're sending a person to something absolutely tragic for a family. How come they know where to go and get the machine? And you're sending referral and making money out of it. 1,000 rupees, 2,000 rupees for what? He's sick. I cannot go and tell you're wrong because he's earning less. But I can at least create a system where people like you or other can call up and say, I need a ventilator, can you give it to me? And then the institutions has to get it. So यो सबै सिस्टमको प्रब्लम हो र हामी साँच्चै नै भन्ने हो भने हामी गरिब देश हो. तर हामी कहाँ त्यो गरिबी हुँदाहुँदै पनि हामीले स्रोत साधन म्यानेज गर्ने एउटा कसरत गर्नुपर्छ के. You need to work on it. And if I say today there is a lot of conscious people like you guys who can go abroad and do something good. You guys are here. And frankly, he came back from Australia. You probably had the choice to go. I came back from somewhere else. So the thing is, this society is changing, but it can be fast forward. So me and my generation has started giving back a lot. We have structured it. We have known what we want. You've suffered.
Has this created a foundation for like a better future?
Yeah, absolutely. We challenge status quo, and we don't sigh.
So this story of mine is 10 years back, right? And and I feel like it's the same story for a lot of people. अहिलेसम्म पनि के.
Yeah.
So how many more years till we can see कि त्यस्तो खालको fast service होस् मान्छेहरूलाई, and so that they don't have to
see nowhere in the world healthcare is fair. Okay, nowhere. It's always a complex, and desirably we always want better because we don't want to lose lives. Okay, it's always dear and close to our heart, and it's always someone's someone.
Right.
So when you think about it, like, it is always a demand is always going to be there that can you do something more. It is philosophical. तर त्यो चाहिँ के हुन्छ भन्देखि कसैले पनि म फिक्स गरिदिन्छु भनेर भन्ने चाहिँ होइन. तर हाम्रो जुन सफरिङको टाइम छ, एक्सेसको टाइम छ, जुन नेभिगेसनको टाइम छ, जुन राइट अप्रोप्रिएट कन्सल्टेसन टाइम छ, रिसोर्सफुलनेस छ, यो सबै कुरामा हामी अपग्रेड हुनुपर्छ. जस्तो एक्सेस भनेको तुरुन्त फोन गर्ने बित्तिकै आउने, एउटा कलमा आउने, एउटा सेन्ट्रलले डिस्प्याच गर्ने,
फास्ट हुनुपर्ने हो
एक्ज्याक्टली हो.
त्यो पनि अब एउटा प्राइभेट अर्गनाइजेसनले नभइकन गभर्नमेन्ट लेभलबाट भएको त एकदमै राम्रो हुन्थ्यो. बट देन प्राइभेट अर्गनाइजेसनले पनि अहिले आई थिङ्क देयर इज ओन्ली, दाइले अघि भन्नुभएको जस्तै 102 इज द ओन्ली सर्भिस मेबी, right? Are there other services as well that we don't know of?
No, we had a Red Cross ko thiyo. A Red Cross kind of defunct and corrupt. So about sad story that Red Cross should have taken it because they take government taxpayers' money and also get a lot of grants. So that's a big institution which is kind of those people are supposed to take care of it. अब त्यो त उनीहरूले गरेन, so then police has a kind of capacity to do it, and because they are like handicapped themselves, they cannot deliver. Now the 1 or 2 has come in.
यो policy level मा नै issue भएको भएर नै अहिले people are suffering त्यसो भए.
Yeah.
हैन?
यसमा hack छ. So I think like there's like more people like you guys who's gonna ask a question and work on it, not by saying hey I'm doing and it's gonna cover all 3 crore मान्छेको लागि यो पुग्छ भनेर. No, nobody has right to tell until unless it's fully covered.
Right.
So I don't want to say the emergency of Darjula gets only in a helicopter service, but when it comes to rescuing with a fracture, it will be a difficult choice. So यस्तो हुन्छ कि कस्तो छ भने डिस्प्यारिटीहरू यो सबै कुराहरू चाहिँ डाइनामिक्स हो हैन, चलिरहन्छ. तर हामीले फन्डामेन्टल कुरामा चाहिँ एक्सेसलाई कहाँ पुर्यायो हैन, ओभरअल
त्यो त इयर अन इयर ग्रोथ हुनुपर्ने थियो नि त दाइ.
हो त्यो
तर फर सो मेनी इयर्स आई फिल लाइक यो यसमा के पनि इम्प्रुभमेन्ट नै नभएको जस्तो के.
So last podcast I was very angry, right? You don't want to make me angry because the more I think about it, more anger comes, right? So
that's also part of my frustration.
So I
think everybody is angry about this.
So
मेरो त एकदम पर्सनल ह्यान्ड एकदमै एङ्ग्री.
No, that is completely
मेरो चाहिँ मैले अस्तिको लास्ट पडकास्ट वाज अबाउट डेङ्गुमा फर्टालिटीहरूमा आई काइन्ड अफ क्लेम लाइक हाम्रो गभर्मेन्ट अकाउन्ट, तर गभर्मेन्ट इज फेसलेस विदाउट डेलिभरी एन्ड लिडरसिप. सो यो कुरा चाहिँ कस्तो हुन्छ भनेदेखि गभर्मेन्टलाई भनेर पनि त हाम्रै मान्छे हो हैन. सो के हुन्छ
That's why we need to choose the right kind of people, no? When we vote.
Well, yes, I mean you have a choice now.
Well, talking about it, who are you choosing this time?
I've been seeing a lot of shares by Bishal Dhai on Gagan Thapa.
Yeah,
he's probably going to vote for him.
It's very hot.
He's very hot.
I heard you guys are friends as well.
Oh yeah,
Gagan Thapa,
long time. So 45-46 हैन फर्स्ट आन्दोलन हामीले सम्झेको.
Right.
तिमीलाई याद छ थाहा छैन?
म त 1 वर्षको थिएँ होला.
Probably same age.
So म चाहिँ 7th ग्रेडमा थिएँ, वनस्थलीमा थिएँ त्यतिखेर. अनि 46-47 मा आन्दोलन हुँदाखेरि गगन दाई वाज 9th grader and I was 7th grader. So he was active then as a political person. Ani Banastali was one of the hub where the action was pretty dynamic. And private institution bhaya pani, I remember those guys who were seniors, like 9-10, they were putting up these the tear gas and throwing back. And we were behind, collecting stones and giving to them. So for
धेरै अगाडिको
democracy ko kurama Gawandai is our generation, our representation, our leader, our champion, हैन. So यसमा म चाहिँ confusion छैन. I will be standing, but fortunately के भयो भने I'm living where he stands. And I've been voting him forever. So
he's done great work in health.
Yeah. For as a doctor, if you ask me, of course I have a long list to tell about what he has done. But as a person, as a Nepali citizen, as a leader, as a institution ma काम गरेर political leadership लाई गर्ने, he is not giving up on system. So यो चाहिँ कस्तो नि म चाहिँ हेल्थ केयर सिस्टममै काम गरेर हेल्थ केयरलाई च्यालेन्ज गर्ने हो नि त. So जस्तो I mean you cannot change the thing by saying oh I'm just going to come and hack it up. No, it's very there are a lot of people involved in any system to change. So political मात्रै हैन, his attempt overall in a system wise thinking, he's already invested. You can think about 2 terms in Constituent Assembly as a member. When हामीले पहिलोचोटि सेलेक्ट गर्दाखेरि म भोट हाल्ने नै हो क्या. सो म चाहिँ मेरो त डाइरेक्ट स्टेक छ भनौँ न उसमा, एन्ड आई ओन हिम होइन, इन अ वे लाइक आई एम भोटिङ, आई एम अ सिटिजन, राइट. तर उसले गरेको काम त मेरो मार्कअप अनुसार हुनु पऱ्यो नि त. इफ आई ओन्ली टक अबाउट सेलेक्टिङ माई पर्सन, डोन्ट आई सी द मार्कसिट, डु यु थिङ्क? आइ एम नट द्याट चिप होइन. सो के हुन्छ भनेदेखि उहाँले गरेको कामहरू हेज अलवेज बिन up to the mark of a नेपालको एस्पिरेसनल जेनेरेसन भन्छ क्या. नेपालको एस्पिरेसनल जेनेरेसन भने के सिस्टममा हुनु पर्यो, प्रोग्रेस हुनु पर्यो होइन. अनि त्यो चाहिँ हाम्रो डाइनामिकमा जानु पर्यो. अनि उसले सबै कुरा फिक्स गर्न त सक्दैन होइन. क्यान आई वान्ट टु हेभ अ हाउस लाइक some rich guy, but can I fix it tomorrow? No. I want to have a road or maybe a car, a better one, but can I fix it tomorrow? Nobody can do it. So त्यो त हामी जति mature हुँदै गयो त्यति बुझ्दै जान्छ. So first time को election मा when we voted him, luckily he became a health minister. हैन फेरि I have things to talk about him. उसको बारेमा कुरा गर्न पाउँछ किन डाक्टर हो हैन. So त्यसपछि सेकेन्ड चोटि we voted. हामीले फर्स्ट चोटि भोट हाल्यो मन्त्री भयो स्वास्थ्य मन्त्री, सेकेन्ड चोटि भोट हाल्यो महामन्त्री भयो, थर्ड चोटि भोट हाल्ने हो प्रधानमन्त्री बनाउने हो भने के. So the thing is so now
you know who he supports.
Oh yeah, absolutely. I have a huge respect for Razan Dai also, and as an intellectual, Razan Bhattrai, he's So he's there, and he's been candidate from UML. It's a very competitive constituency, एकदम highlight of the country. अब यो सबै कुराहरू हुँदाखेरि पनि हामी we have to choose at the end of the day. So मलाई चाहिँ as a doctor मैले उले काम गरेको पनि health ministry मा देख्या हो, त्यो 9 month मा उले गरेको transformation कुराहरू पनि छ. So and I know what he worked as in COVID, and he was open and going and collaborating with Prime Minister. He had a plan to give it to the government by saying, let's create a bipartisan COVID platform to serve the people. It is big. Nepal ko lagi unique experiment ho. There was a lot of corruption that happened in between. त्यो कुरा चाहिँ धेरैलाई थाहा छैन. So bipartisan भनेको कांग्रेस भए पनि गएर कम्युनिस्ट को लिडर सँग हाम्रो कोभिड फ्रेमवर्क बनाऊ हामी काम गरौँ भनेर भने हो. And I'm ready to volunteer पनि भने हो. Not as a constant, he's open minded on that, it was crisis. So I got to work later on. हामीले 5000 जति परिवारलाई त्यो एरियाको मान्छेहरूलाई चाहिँ फ्री कोभिड कन्सल्टेसन गराएको छ. And he made a point like they didn't suffer. None of the people died. Magic, right? And I'm witness to it because we were part of it. Now in dengue also he is active. So how many कति जना constituent member ले कोभिड को बेलामा कति जनालाई सपोर्ट गर्यो, कति जनालाई डेङ्गुमा सपोर्ट गर्यो भन्दाखेरि अलमोस्ट 0 हुन्छ भनेको. त्यहाँको त कन्स्टिट्युएन्ट एसेम्ब्ली कन्स्टिट्युएन्ट मेम्बर त्यहाँको families can actually call his office and say I need dengue support. Test pani free ma.
Yeah, it's free now.
Yeah, still. So the thing is, mero bhanai ke bhane, he's not man of words, he's man of action.
Yeah. So like coming to the end of the show, right? So we got to know a lot about you and a lot of experiences shared. So to end the podcast, and then let's say hamro audiences like somebody who wants to be, I don't know, a social entrepreneur in future and who's probably thinking like मलाई पनि यस्तै खालको प्रब्लम्सहरु छ, मलाई नि यही गर्नु छ भनेर सोचिरहेको छ भने चाहिँ what is that one advice that you would probably give them to sort of be a social entrepreneur or thinking of being a social entrepreneur?
Social entrepreneur is someone who actually works for people, profit and impact. And you need to make profit out of your process, and you need to reinvest in people. So today some people are copying us. हामीले कपी गरेर होला या हेल्थ एट होम जस्तै होला या बेटर होला भन्दाखेरि आज पेशेन्टले चोइस पायो कि उसको डाइपर चेन्ज गर्न या उसलाई चाहिँ नेजल फिडिङ गर्न भनेको नाकबाट खाना खुवाउन या दिशा पिसाब गर्ने ठाउँमा चाहिँ भएको पाइपहरूलाई सफा गर्नलाई उसलाई गाह्रो भएन या परिवारलाई अन्यल भएन. सो त्यो अपर्च्युनिटी पनि हो भनेर हेर्न सक्ने नजरिया चाहिन्छ कि. सो आउटलुक चाहियो कि opportunity in those kind of market are abundant. So तर not all beautiful thing are big. It can be small too. सानो पनि हुन सक्छ नि त. सो हामी के चाहिँ चाहन्छौँ भने हामी सबैजना ट्रान्सफर्मेसनमा हामीलाई फाइदा होस् भन्ने हो के. तर मैले धेरै मान्छेलाई फाइदा दिएँ भने त मलाई पनि फाइदा हुन्छ नि त. सो सोशल एन्टरप्रेन्योरले चाहिँ पिपलको एंगलबाट इम्प्याक्ट हेर्न सिक्नुपर्छ. तर त्यो चाहिँ फेरि प्र्याक्टिस चाहिन्छ.
धेरै यङ मान्छेहरूको एस्पिरेसन भनेको पैसा कमाउँ, रिच हौँ भन्ने हुन्छ नि त. बट देन बाई बिइङ अ सोशल एन्टरप्रेन्योर इज देयर अ फ्युचर in terms of having money at the same time? as well.
There's a lot of work to do, man. I mean, I tell you.
समाज सेवा जस्तो खालको मात्र हुने हो कि पैसा पनि कमाउने
होइन हेल्थ केयर त सजिलो छ होइन म त एकदमै
हेल्थ एट होम हेज प्रुभन इट पैसा छ
नो आई टेल यु मोर देन हेल्थ केयर हामीलाई मास्लोज हायरार्कीमा खाना एकदम जरुरी कुरा हो लुगा एकदम जरुरी हो हाम्रो धेरै कामहरू त्यो एरियामा बाँकी छ हाम्रो सस्टेनेबल लिभिङको बारेमा कुरा छ इकोलोजीसँग रिलेटेड वेस्ट म्यानेजमेन्टमा त्यतिकै काम छ सो वी हेभ लट अफ वर्क रिमेनिङ अन दोज एरियाज अल्सो सो इफ यु गोइङ टु चेन्ज एनिथिङ पोसिबल इन एग्रोटेक होइन अनि त्यो चाहिँ कस्तो छ भने हामीसँगको अपर्च्युनिटिजहरू एकदमै छ क्या अनि I think like we need champions. We need champions who's getting passionate people. They will change things. Like, you know, it's not only about cliche organic stuff and supplies. It's about changing that whole agro supply delivery chain. You know, there's a lot of work. So that takes a passionate. You're a dreamer science, okay? अनि उसले त्यो सप्लाई चेनमा टन्नै मान्छे खडा गर्छ अनि त्यो चाहिँ डिस्रप्सन हो त्यो इन्स्टिट्युसनलाई करप्ट होला तिमीले भने जस्तो इनइफिसियन्ट होला या त्यहाँ भनौँ न अब हामीले खराब क्वालिटीको सामानहरू किनिराख्या होला तर त्यो राम्रो कसरी हुन्छ त हो सोशल एन्टरप्रेन्योर क्यान बी दोज काइन्ड अफ च्याम्पियन्स सो इफ यु आर बाइङ अ प्रडक्ट फर इक्जाम्पल स्याउ क्यान यु टेल मी हाउ मच पेस्टिसाइड इज इन देयर
No.
So who takes responsibility of that? So that ends the conversation for now. Okay.
So there are levels to it. So we might do this next time too. So just to end the podcast, like one quote that you live by.
Well, there are many.
Of course, like one of your favorite quotes.
One that you actually live by.
So there is a Robert Frost poem that I think that's the only philosophy that I actually carry along. So there's a poem called two road that diverges on a woods. One has a road that is taken by a lot of people and it has the steps that you can see that the way is there. The other one has no road in it. It's just a grass and you know you can take that road and you can take a risk. So it's called a road less traveled. So I recommend you guys to read that. It's by Robert Frost, an American poet.
Will do.
It's a philosophy of my life. So I've taken a road which is less traveled and that's where the success is found easily.
Wow.
That's great.
Amazing.
So I actually have this one last question that before we end it. So normally the podcaster, whenever people meet you, they ask about your success stories. I know. Or you talk about your failure stories as well. So एउटा इन्टरभ्यूमा हेरेको थिएँ you were saying I've failed 100 times.
Yeah.
होइन तर 100 timesमा there was only 3 times that I succeeded, which makes it 3%. होइन सो त्यो 3%मा त सक्सेस रेट छ भनेर के अब म ट्राई नगरौँ त बिकज आई फेल 97 times म ट्राई नगरौँ त भनेर भन्नुभएको थियो होइन सो यही कन्टेक्स्टमा वाट आई वान आस्क इज वाट इज वान थिङ यहाँ चाहिँ तिमी फेल भएरै सिक्नुपर्छ है for entrepreneurs, okay, basically. So doing by learning by doing भनेर भन्छ नि तर यहाँ तिमीले बिगारिसकेपछि त you'll have a better perspective about this angle, about this forte or genre जे पनि हुन्छ. So do you have one thing to suggest to our audience कि तिमी यहाँ फेल हो एकचोटि यहाँ गएर लड एकचोटि then you'll have the taste of it. Do you have something like that?
Yeah. Always. It's very simple. I have one thing that I keep on repeating the mistake that you have to believe people. Without believing in people, you cannot succeed. I cannot experiment with my patients because they are vulnerable, and they have to be protected. And I keep that as our mandate. But I have to believe in people because people are something that is very deceiving. Like they will say something to you, and you have to believe them, and then they will tomorrow leave you, and then they will probably create nonsense and kind of be very mean to the whole process of what you have invested in across these years, which is okay. So if I stop believing in people, my whole process will stop. So they will come, they will go, you know, sometimes it will be my mistake, sometimes it will be their mistakes. But if we keep on inherently not trusting people and building momentum around the thing that is more purposeful for you, it will hurt you more. That's what I believe in. So constant threat and constant difficulty is believing in people. And in any enterprise you do, you have this challenge that you need team, and the team is thing that will not stay with you forever.
Right.
So that is something that we have to try and learn by doing, right?
That was really deep. That was really deep. I wasn't expecting that from you, but that was really deep.
There are layers to it.
Yeah.
It's there's a 15 years of hustle in my soldier. So you can always learn something or other.
Exactly.
But it's also difficult to not believe in people.
Right.
Because there's so much amazing people in the world that you can always get fascinated with. And it opens up your horizon of thinking, you're experimenting, and you take decisions based on that. So, you know, if you want to be successful, you need to have that belief cofactor in people. Because, you know, but then they keep on changing. And some people will stay with you forever in different formats.
Right.
Perfect. Thank you so much, Dai, for doing this with us.
It was such an honor to have you here today.
Thank you.
The opener show was a bang, hopefully, right?
Yeah,
So
I mean, it's always a pleasure. So the thing is, I'm privileged to be here with you guys as an opening pop talk. And
hopefully the #1 podcast of Nepal in future.
yeah.
Hopefully, why not? Why not? Bishal Dhakal on Raaz hamro opening show ma so.
Exactly.
Of course.
Exactly.
I mean, I might not be the perfect choice, but yeah, I mean, I enjoyed it a lot. Yeah.
Thank you so much, Dai.
Thank you so much. Yeah.
Thank you very much.
Thanks.
So
guys.
with this, we in the first ever episode of Pop Talk. Thank you to Irish Pop Company for letting us do it here. Thank you to Yellowworks TV for making this happen. Thank you, Bishal Dhai, for being our first ever guest.
Thank you so much, guys.
Thank you for inspiring us, like always.
Always, yes.
So, जस्तै हामीले खास यो सो सोचिरहेको पनि त्यसै थियो कि we don't get to interact a lot, we don't get into layers a lot, but this kind of podcast really helps us sort of you know get to know you better and get to know people better भनेर नै हामीले यो सो सुरु गरेको हो. So thank you so much.
So yeah, that noise pub ma यस्तै हुन्छ boys.
Of course.
भाडा बजिरहेछ, आवाज आइरहेछ, तर हामी I mean I think I was I was bold enough to, it's kind of, you know, it's messy.
Pin drop silence भयो भने पनि
But ठिक छ, okay, I'm ready for experiment. That's what my thing is about.
We are all experimenting. This is one of a kind thing that we are trying to do. Hopefully we'll be doing better shows in the future as well.
No, it's perfect. I mean, I think it's just a talk that you guys want to float it.
Right.
And it improves with time, and audience will be always there to judge. So, yeah, I mean, best of luck.
Thank you so much.
And we'll do next time without a coffee, over whiskey. Thank you so much.
That would be nice.
Thank you so much. Thank you so much.
So, Prashraya, how was your experience as a Bishal Dhakal कुरा गरेर?
मलाई त एकदमै रमाइलो लाग्यो हैन. This is our first ever episode.
And तिम्रो त few podcast गरिसक्यो. मेरो चाहिँ first podcast हो by the way.
ए हो र. But then again, like, this was first time hosting, no? So it was a really good experience. जस्तो हामीले envision गरेको थियौं for Pop Talk to be. हामीले आफ्नै pub मा गर्न पाइरहेको छौं, right? With the people we are really inspired with. अनि उहाँले जति पनि कुरा गर्नुभयो, like I am very I'm not being able to find the right word, but like very influenced and very
always उहाँसँग कुरा गर्दाखेरि त्यो एकदम इन्स्पायरिङ कुरा, अलिकति त्यो मोटिभेट गरिदिइहाल्नुहुन्छ क्या, त्यो एकदम त्यो अग्रेसिभ नेचरमा हैन, सटल इन्स्पायर गरिदिइहाल्नुहुन्छ नि त उहाँले.
And the great work that he has been doing, like, it's fantastic.
Absolutely.
Right? I think, like, at some levels we've been able to inspire at least few people, maybe, like with someone like Dr. Bishal Dhakal. Right? And we'll be bringing in a lot of influential people that we know, that we are connected with. Hopefully, you know, we'll learn a lot of things from them. Hopefully we'll be learning a lot of and getting more experience out of them. Okay? I think हामीले normally सिक्ने भनेको उहाँहरुको मिस्टेक्सहरुबाट, उहाँहरुको एक्सपिरियन्सहरुबाट हो नि त. So I think this will be a good platform for everybody to learn along with us. So with that being said, thank you so much, guys, for staying with us. We really had like a good fun.
Absolute fun time. Absolutely fun time.
So just to leave the audience just trying to leave the audience with a very nice quote that that I heard today. So it does not matter where you came from, it matters where you're going.
Okay. So म चाहिँ खतर कुरा भनिदिन्छु, एकदम सिक्रेट हो हैन, सिक्रेट रिभिल चाहिँ So 1.5 घन्टासम्म यसरी पेट तानेर बस्न चाहिँ लास्ट गाह्रो हुँदो रहेछ यार. So finally I have to release it.
That means you need to work out, bro.
Oh well, thinking about it. Thinking
about working out. Okay. At least go on a diet first.
Sure. Absolutely there, man. Absolutely. I'll follow that. I'll take your advice.